Welcome to the cytomegalovirus training module. Our short video is made to help teach childcare providers about CMV. What you learn today can apply to your everyday work at your childcare center, so make sure to pay attention. Alright, let's get started. Acknowledgements. This video was developed using information from the CDC, National CMV Foundation, American Academy of Pediatrics, and Child Care Education Committee. The video tasks for today are to learn about cytomegalovirus and congenital cytomegalovirus, go over important facts you've learned during this video, and finally take a short quiz at the end of this video. By the end of the video, you should be able to describe cytomegalovirus and congenital CMV, identify signs and symptoms, and understand what you should do so you do not get cytomegalovirus. Alright, first let's talk about cytomegalovirus. Cytomegalovirus, also known as CMV, is a common type of the herpes virus. A person can get CMV from a seropositive person through bodily fluids such as blood, urine, saliva, tears, semen, and breast milk. Seropositive means a positive blood result for antibodies to CMV. There are different times when there is more CMV in their bodily fluids. Now I'm sure you are wondering why you should care about CMV in this process. Just being childcare providers puts you at risk of getting CMV. Think about when you are changing diapers, picking up infants' toys, feeding infants. You are constantly in contact with bodily fluids throughout your workday. In our upcoming slides, we will also go over signs and symptoms, which are not always clear. This means you need to take the proper precautions when in contact with such a large amount of bodily fluids every day. Facts about cytomegalovirus. Most of the time, CMV stays in a person's body at very low levels and is not contagious, but there are times it becomes active again and can pass to another person. In daycare settings, roughly 30 to 40% of preschoolers have CMV in their saliva and/or urine. These facts are important as this means a large amount of your preschoolers have CMV in their system. Now let's talk about congenital cytomegalovirus. Congenital CMV is very similar to CMV. The biggest difference is the person who comes in contact with CMV is pregnant. This means the pregnant woman then gives the CMV to her unborn child. Therefore, the child will be born with congenital CMV. Here are some important facts about congenital CMV to keep in mind. 90% of babies show no signs of the virus at birth. This means the child could have some of the long-term side effects that are associated with congenital CMV, even if they are not visible at first. In addition, 40 to 58% of babies with symptoms will have long-lasting side effects. And finally, 13.5% of babies with no symptoms at birth will later develop long-lasting side effects. In the upcoming slides, we will review just what these lasting side effects are. Signs and symptoms. Signs and symptoms can vary for CMV. There can be no signs of CMV to very severe side effects if the person contracting CMV is already weak or has another illness. Most commonly, CMV will appear as a common cold with tiredness, fever, and sore throat symptoms. As for congenital CMV, the signs are usually much more clear at birth. The infant can have a swollen liver or spleen, red or purple spots on the skin, a head much smaller than normal, hearing loss, low birth weight, and jaundice or yellowing of the skin. In some states, if a child does not pass their newborn hearing test, they will get either a blood, urine, or saliva test to check if the child has congenital CMV. It can only be titled that the child has congenital CMV if they are tested in the first 3 weeks of life. Now I am sure you are wondering why this is important. Congenital CMV has much more serious long-term side effects as compared to CMV, and the symptoms can take up to a year and a half to be noticed. Hearing loss in individuals with congenital CMV can also come on later in life or get worse over time, which means these children with congenital CMV need to have a close eye kept on them even if they pass their newborn hearing screening. Here are some possible side effects from congenital CMV. They can range in how strong they are. It really depends on the person and the amount of congenital CMV virus in their body. Hearing loss, vision loss, mental disability, microcephaly, small head or brain, intracranial calcifications, lack of coordination, cerebral palsy, feeding issues/failure to thrive, sleeping, behavior, and sensory issues, seizures, death in rare cases. These were all retrieved from the National CMV Foundation website. Okay, so we have learned all about CMV and congenital CMV, so let's talk about things you can do. Here are some helpful tips to help with preventing CMV. Be sure to wash your hands a lot, especially when in contact with bodily fluids. Do not share food or drinks with children. Although this seems silly, sharing food or drinks with children is putting you in direct contact with their bodily fluids, putting you in direct contact with CMV if the child also has it. Also, do not try to come in contact with saliva when kissing young children. Finally, I know a lot of mothers like to clean off their child's pacifier with their own mouth before giving it to their infant, but again, this puts you in direct contact with your child's bodily fluid, so please try not to do this. It is also important to note that baby wipes do not kill all viruses and diseases. As a childcare provider, I am sure it seems simple to use a baby wipe to clean your hands after changing a diaper, as they might be right in your reach. But you must wash your hands regularly or use hand sanitizer to properly clean your hands. What we know today. Now this slide I think is very shocking. This is awareness of cytomegalovirus. In my opinion, this graphic shows clearly how much awareness is needed for CMV. As you can see, CMV is actually the most common of all the disorders listed, many of which I'm sure you have heard of: HIV, AIDS, Down syndrome, etc. Yet women's awareness of CMV is only an astounding 9%. This means even though it is one of the most common conditions, less than 10% of women know about it. We need to spread awareness for a disorder that is so common. I hope you can now see the importance of sharing what you learned today with those around you. Okay, so we are near the end of this video and it's almost time for your quiz. Now let's review what we have learned today about CMV and CCMV. First, let's talk about CMV. CMV is transmitted through bodily fluids such as saliva, blood, and urine. It can appear as a common cold, or the person with CMV can have no symptoms at all. There are different times when there is more CMV in their bodily fluids. Congenital CMV, on the other hand, is when the mother gets CMV and passes it to her unborn child. Congenital CMV can have lasting side effects on the baby, and has to be diagnosed in the first 3 weeks of life to be said that it's congenital CMV. Finally, as for prevention of CMV and congenital CMV, we need to increase awareness of this disease. It is the most common long-term medical developing condition in infants in the US, yet only 9% of women are aware of this disorder. Proper hand washing is needed to lower chances of contracting the disease, and baby wipes will not properly disinfect your hands. Avoid coming in contact with bodily fluids with all infants, especially if you're pregnant. This includes not sharing food or drinks with young children. For more information, visit the National CMV Foundation and CDC. Here are some more resources. All right, it's time for the quiz. Please take the short quiz provided.